Hi everyone, I am Leah Bagley, as many of you know. Unfortunately, my unit is in the field this weekend, so I'm unable to be with you all to do my portion of the presentation. So I will be recording my piece, and then Jennifer Kaysen, who is my partner, will be showing you my slides and then going into her portion. So today we will be talking about preschool age children and their development. So by age 3, a child should have their 20 primary teeth in, and this is incredibly important to make note of because the earlier you expose children to brushing their teeth, the easier it will be for them to transition into doing it themselves. One thing that a lot of people do not consider is that breast milk can actually cause cavities. So as children start to get teeth, even if they're still just breastfeeding, they need to have their teeth brushed. So this is something incredibly important during this age range because it's the age where they start to not want to do stuff like that. So we need to be very cognizant in encouraging this. These children should not have any progression through Tanner stages. So if a child comes in and they appear to be advanced in development or they are in a stage of puberty, this needs to be further addressed by endocrinology or another specialist because this is not appropriate. The height at age 5 should be about double the birth height, and the weight by age 5 should be about 5 times the birth weight. So this is an easy way to kind of reference this, especially knowing that kids develop differently, and usually if they have a decreased height at birth, it will likely trend, but as long as they're trending in the appropriate direction, it's a good thing. The brain at this point is 80% developed in size by age 3. Most of the other organs are starting to become adult sized. This is why we know that bowel and bladder can be controlled at this age. However, we do see a decrease in body fat. They become leaner. By age 4, the heart becomes anatomically correct in the right location, and the ribs are still not fully covering as deep as they do in adults. So sometimes this can leave a child exposed to abdominal trauma just because the ribs aren't covering the diaphragm as well as they do in adults. On this slide, we have a graph of height and weight reference for ages 2 to 10. So this is important to obviously just have a reference in the office. The nutritional requirements are also featured on this slide, which is something that's important, especially if you have a child that is not eating the way that they should, or they appear to be malnutrition. This is something to take note of. Do a 3-day diary and then address this with the parents. I also have on here preschool vital signs. So the heart minimum should not be less than 60 in rate. It should not be over 130. The blood pressure 50 percentile is 105/70. The respiratory rate 20 to 25. Excuse me. In this slide, we have in reference to head circumference. So we can see here that this one right here is what we're looking at in this age range. So we know that between ages 3 and 5, the head is increasing in circumference a ½ inch per year. And of course, this is important because we not only can detect physical growth, but it can also indicate a cognitive or intellectual issue as well. And of course, all primitive reflexes should be gone by this stage. So the next few slides are graphs of different developments. So the first one being motor. So just a few examples. At age 3, you should be able to pedal a tricycle for gross motor. Fine motor, you should be able to undress yourself. 4 years old, you should be able to hop on one foot and then draw an X. By 5, you should be able to balance on one foot, and then you should be able to hold your pencil in a tripod gesture. So the next we have communication and language. So 3 years old, you should use 3-word sentences. And one thing I think is incredibly important is that 75% of the language should be understandable. So a lot of the times this is where a provider can pick this up, especially because they are not seeing the child every day. They might be able to determine that most of their language is not understandable, although the vocab might be there, they don't know it's not being received. So this patient will need to go to speech language pathology or someone to get this addressed. So at age 4, 4-word sentences, and it should be 100% understandable. And then by 5, the vocabulary grows, sentences become more understood in terms of structure, and they could be a lot longer and more descriptive. And then this next one tells us about cognitive development. So at age 3, the child should be able to do make-believe. At 4, they should be able to understand a concept of time. And at 5, they should be able to draw a person with the correct body parts externally that they can see. So this concludes my half of the presentation. So Jennifer will slowly go through my slides in case there's notes to be taken, and then she will continue on. Thank you.